A patient with diabetes wakes up with high fasting glucose. The common mistake is to immediately increase the bedtime insulin. But clinically, that can be dangerous, because morning hyperglycemia is only the final reading. It does not tell us what happened during the night. So the best next step is to check the overnight CGM pattern, or check a 2 to 3 a.m. glucose for a few nights. This helps us separate dawn phenomenon, Somogyi effect, and waning basal insulin. In dawn phenomenon, the glucose is normal or high overnight, and then gradually rises toward early morning. This happens because hormones like growth hormone, cortisol, catecholamines, and glucagon increase hepatic glucose output. In diabetes, insulin action is not enough to control this rise, so the patient wakes up hyperglycemic. The key point is, there is no preceding nocturnal hypoglycemia. Somogyi effect is different. Here, the patient first develops nocturnal hypoglycemia, often because of excess evening insulin, a missed meal, exercise, or alcohol. The body responds with counter-regulatory hormones, and glucose rebounds by morning. So on CGM, you expect a nighttime dip, followed by a morning rise. But remember this point. Somogyi effect is classically taught, but in modern CGM practice it is uncommon and often overdiagnosed. Do not diagnose Somogyi just because the fasting glucose is high. The comparison is simple. Low glucose at 2 to 3 a.m. suggests a Somogyi pattern. Normal or high glucose at 2 to 3 a.m. suggests dawn phenomenon or waning basal insulin. Morning glucose alone cannot tell you the cause. Management depends on the pattern. If it is dawn phenomenon, optimize basal insulin dose or timing, consider a longer-acting basal insulin, or adjust the pump basal rate before dawn. If it is Somogyi pattern, do the opposite. Prevent nocturnal hypoglycemia. Reduce or adjust the evening insulin, and review meals, exercise, alcohol, and insulin timing. If basal insulin is wearing off, improve basal coverage. So the clinical pearl is this. Morning glucose tells you the result, but overnight, CGM tells you the diagnosis. Never treat fasting hyperglycemia blindly. First, identify the overnight pattern.